welcome to Ask Dr. B. I hope you're enjoying the fever playlist. Today I'm going to talk about when you need to worry about your child's fever. Ask Dr. B. We're really lucky here in the UK. The National Institute of Clinical Excellence has done all the work for us. They've gone through all the studies and all the research to put together a list of when we need to worry about a child's fever. I've put a link down below to their website, which has really good documentation about what you need to look for and when you need to worry. But I'm going to try and go through it really quickly in this video. Now, I really should point out that these guidelines, though they're really good, do not apply to children who have recently been admitted to intensive care because their immune system is probably knackered and will not be able to respond as well as the children in the studies that they looked at. It doesn't apply to children that have a chronic illness where fever may be a sign of something else or fever is a reason to worry in a different way. For example, children with sickle cell disease. It doesn't apply to children who have recently come back from a tropical country because the reasons behind their fever may not be the same as the children included in the studies. And it doesn't apply to children that have a recurring fever. This may be a sign of something else. Fever is not always a sign of infection, and if your child has a recurring fever, it is important they get looked at by a doctor. So, the National Institute of Clinical Excellence tells us that we need to worry about a child with fever if they meet the following criteria. Number 1, they're less than 3 months old. I think I've said in another video that between 0 and 3 months, a child's immune system is totally different. They're living on borrowed antibodies from their mother, and also their barrier immunity, that's the ability to contain an infection within one organ, is really poor, so they can get overwhelmed by infections very easily as the bacteria move all around their body. Number 2, the child is 3 to 6 months old and has a fever over 39 degrees. Now usually the height of the temperature is not an indicator of how sick a child is, but they know from the studies included in this review that the children who were between 3 and 6 months old and had a temperature over 39 degrees were more likely to have a bacterial infection. It doesn't mean they were more likely to get very sick, but it was important in these children to identify where the infection was and treat them appropriately. If your child has a non-blanching rash, now this is a rash that often has us worrying about meningococcal septicemia. I've put a link to the Meningococcal Society where they really go through how to assess the rash in detail. But if you're worried about your child's rash, it doesn't blanch when you either roll a glass over it or press on it, then definitely go to a doctor. If you're not sure how to assess the rash, then also go to a doctor. We would much rather see children that have a rash that isn't concerning than have your child deteriorate at home. Your child continues to deteriorate. Now, most people look dreadful and feel dreadful when their temperature is up, but often once the temperature settles and is back to normal, the child is bouncing around and running around. But if your child stays in bed and is lethargic or irritable or just not themselves, then it's worth them being reviewed by a doctor. You have concerns about looking after your child. I've said this time and time again, parental instinct is a really, really useful sign. You've seen your child have loads of fevers, and if you're worried about your child, then definitely get them to a hospital. The fever has lasted more than 5 days. If your child has a fever for more than 5 days, it may not be just an infection. Sometimes fever can be caused by an autoimmune condition or other reasons that can generate a temperature. So if your child has a fever for more than 5 days, it's important that they're looked at by a medical professional. So those are the nice recommendations for when you need to worry about your child having a fever. And I'm going to add a few more based on my experience as a consultant pediatrician. Number 1, if your child has had chickenpox recently or is beyond the 5th day of their chickenpox illness. Now, chickenpox will mess with your immune system in a ridiculous way and affect your child's ability to fight simple infections. So if your child has recently had chickenpox or is just recovering from chickenpox and they develop a fever, then it's important that they get reviewed. It's a bit tricky because fever is part of the chickenpox illness, but if your child is having a fever beyond the 5th day of their chickenpox illness, that again is a sign that something else may be coexisting with the chickenpox. if your child is unvaccinated. A lot of the children that were included in the studies that were used to develop those guidelines were vaccinated. More recently, we've had a low uptake of vaccination here in the UK, and that has changed the fever spectrum a little. So if your child is unvaccinated, these warning points cannot be applied to them, and it's important that they get reviewed. You can't work out where the child's fever is coming from. We don't always know where children's fever is coming from, but if they've had a fever for more than 3 days, you should start to see signs that suggest where the illness is. And if you can't work that out, it's important to get the child reviewed just to know where it's coming from so you know what to expect. So that's it. I hope it's been really useful and made clear when exactly you need to worry about your child's fever. Don't forget to use your parental instincts. See a GP. This video is not a substitute for your doctor. It's simply a guideline in case you've got some questions. I hope you enjoyed watching. Please continue to send your questions in.